Hi, I'm Julie Entwistle and you're watching OTV, where we're going to provide you with solutions for living. On this episode, we're going to talk about how OTs play an integral role in the recovery of someone who has a concussion or post-concussion syndrome or PCS. I'm not going to review the medical definitions of these two terms, but what I will mention is that PCS is diagnosed 4 weeks after a concussion if 3 or more of the following symptoms remain: fatigue, disordered sleep, headaches, vertigo, irritability or aggression, anxiety, depression or affective instability, changes in personality, apathy, or lack of spontaneity. In addition to these problems, our clients with concussion or PCS also report functional difficulties such as getting overwhelmed in busy community environments, light and/or noise sensitivity, decreased ability to focus, balance issues, and even report feeling foggy or like they are floating. You can imagine with these problems how difficult it can be to manage even basic daily tasks. Well, the good news is that occupational therapy can help. When working with our clients with concussion, it's best to start with education. This involves pacing education, trial and error, and tracking of activities so people can strike the right balance now while increasing demand slowly as symptoms improve. Rest is an extremely important part of the recovery process, and our job is to help people achieve the balance of cognitive and physical rest while still helping them to manage their important life roles. Often we are responsible for setting return to work, school, sports, or fun guidelines for clients with their employers, teachers, and parents. We are also integral at helping to address the specific concussion and PCS symptoms that clients find so troublesome. This includes how to manage head pain through suggesting ice, rest, or by facilitating other medical consultations, noise and light sensitivity through trying noise-reducing headphones, earbuds, or light music in public, dark glasses, or drawing the blinds in the house. Dizziness and floating can sometimes be helped with suspenders, use of a weighted vest, or even tight underclothing to provide more proprioceptive feedback. Memory strategies are also very common and often involve training on using a smartphone for calendars, contacts, and lists, planners on the fridge or wall, and drop spots for your keys and wallet. For changes in vision, we will try binasal occlusion, vision therapy, or will prescribe visual motor and perceptual activities. And for fatigue, we will address sleep hygiene, use of timers or alarms, scheduling of sleep, and even relaxation to help make falling asleep faster. Of course, these are just a few suggestions based on the common symptoms of concussions and PCS. In the end, remember that each person, each disability, and each environment often needs a unique solution to any given problem. Seek the services of an occupational therapist if you have a functional problem to solve. Well, that concludes this episode of OTV.